it could be pain, it could be affection, care, crying at times. But above all, we really need to recognize that, no matter whatever love is for you, but above all, it's equality. And all those who don't, agree with me, you really need to calm down. So moving ahead, our today's guest of honor is Dr. Aksa Sheikh. I guess she doesn't need an introduction because her name is enough. But just to tell her about her, she is the associate professor for community medicine at HIMSR, that is Hamdard Institute of Medical Sciences and Research at New Delhi. And she's also the first transgender woman to head a COVID-19 center, not only in India, but around the globe. And we are very proud to have to say that we belong to the country that she's a part of, because she's not only making lives better for the other transgender person, but also for all people, whether it is starting from Coho or being a doctor in community medicine. She is, doing fabulous jobs every day. So we move on today and we so and Bengal is like Aba. Thank you, Mariam. So we move ahead and I'll just tell you brief about that. Our today's topic is about Dr. Aksa's life, obviously, and a little bit touching about COVID-19 and how it has affected the health of LGBT individuals. Over to you, ma'am.
Hello, Bhavya, and thank you for having me. It's really, a different feeling to be with young people and with doing a little informal interview. So I hope I'm allowed to be a little informal in today's interview. I'm a little bored of formal interviews now. I hope I have that liberty.
Okay, ma'am. So I think we can begin by with your only life. Like, how is it, to be, first of all, in this pandemic and being in like not only India's but world's first transgender person, where trans people are, they're not even given the very best basic amenities, and you're not only working for them but for the entire humanity. How does it feel?
I'm reminded of a quote which Javed Akhtar said a couple of days back. He said that the things are so bad that I feel guilty that I'm not affected by this epidemic. So, sometimes when you see so much of discrimination around you, and especially when it comes to the trans persons, you actually feel, why am I so privileged? What have I done so different to get so much privilege in the same place, in the same society, in the same country where other trans persons are even finding it difficult to live their life? They are finding it difficult to enter a hospital as a patient. They are finding it difficult to access vaccination in a hospital setup. And then to reclaim your space in such a transphobic environment where an ordinary trans person finds it difficult to just walk through, you head that place, you command that center. It's a feeling which I can't really describe in words, but then at the same time, I feel ki, what have I done so different to deserve this, or what have the other trans persons done so bad, or what is their really crime, or that the society does not even give them their equal due respect. And I always say this in all my interviews that though it's a good feeling to be the first, to be the only one. I was just wondering yesterday, because I haven't heard of any other trans person in any country or in Asia or in any other place where they're heading a COVID vaccination center. So it feels great, and that, okay, my name will go down in history as the first one. But to be the only one, it's a very lonely feeling. It's okay to be the first, but I don't want to be the last one for the next few years till the time the vaccination is going on. So I want more and more trans persons to enter medical field. I want more trans persons to head their teams. I want more trans persons to not just be standing in the queue of the vaccination, but to command a vaccination center. So that's what we really desire. Otherwise, being only one or being the first does not have any meaning. So I was watching this movie Gunjan Saxena. I'm sure a lot of young women over here would have also watched it, and the feeling is somewhat like that, to be in that place where your types haven't had that place before on the table. So the struggles which Gunjan faced, for example, to deserve respect as the first female Air Force officer of India. Similarly, it's a struggle, to be the first transgender person to head a COVID vaccination center, because you have to constantly prove yourself. Because generally we feel that leadership roles, the role of the captain, in fact, whenever I say the word captain, the person in front of you, the image which comes is that of a man. Rarely, when I say the word captain, the image is going to come of a woman. So it's so much ingrained, that to imagine a trans person heading a COVID vaccination center is difficult. But as I said, it's also a struggle, because you have to constantly keep proving your mettle. You have to constantly, tell them that someone didn't just make you as a token, head, but you actually worked through your abilities to deserve this, and that you command this respect. So it has been a long journey, from the first in the medical college to right now. I entered the medical college in the year 2000. So it's been a 21-year long journey right now. And yeah, I am today. I'll keep my answers short so that it's more conversational, and would really want more questions and audience interaction if possible.
Sure. That was a really, I would say, really great head start to the event. So I would just say that, before we begin ahead, I want everyone to, learn this thing, that be anything you want to be the first one, but not the last one. So that was like a really, I would say, a clapping line, or like I was very thrilled to listen to that. So mom, just like a little bit about your history, that, how was your experience while transitioning? And I mean, I know you must be bored listening to this question over and over again, but I think it's like really important that, we commemorate that, how, why or why not the people who you worked with, or your family, did they really support you, or they did not? And if they did not, was it a hurdle for you? Like how these 21 years and your transition has been so far.
As you correctly mentioned, I've been asked this question many a times, and if I remember correctly, every time my answer has been different. And I'll tell you why. It's not that I intentionally change my answer or anything, because as I keep moving further in my life, as I keep transitioning every day, because every day is a transition, and therefore my experience of transition keeps changing. Okay. I'll come closer to the mic if that's helpful, because someone has mentioned that the sound is not very clear. Is my sound okay? Yeah.
Yes, mom, it's been perfect since.
Okay. So, every time my answer is different, because if you ask me today how my story of transition is, and if you ask me after 1 month, that 1 month also is a period of transition for me, because my transition is in perpetuity, it's going on. And for every other trans person, I think it's the same. They're always transitioning. And therefore, the answer is same. And therefore, I can never really get bored of, answering this. So, first and foremost, and if I can explain this, because it is something that needs explaining. When I transitioned, I felt happiness. When I was transitioning, I was feeling happiness. And when I felt happiness, that's an emotion, that's a feeling. I can't describe to you how happiness feels like. You have to be happy to understand what happiness is like. And in that moment, I used to tell my friends that whatever emotion, euphoria, happiness that I'm having right now, I had never experienced this emotion in 30 years of my life before that. I started transitioning at the age of 34. I'm 38 now. So it's only 4 years since I started transitioning. It was quite late in my life, as compared to other people, but it's okay. You are always in your own timeline. So in the previous 34 years, I had never felt that emotion of happiness, which I felt, when I started transitioning. And people would always, ask me this question, ki if you are given a choice of going back to the person you were, will you prefer that or will you prefer this? Or another question is, if you get another life and the same life, will you still transition? And my answer is, I'll transition probably at half the age. Probably if I did transition at 34, I'll probably want to transition at 17, and if possible, right early in my childhood. Because those 34 years which I survived through, I never felt happiness. What is genuine happiness? I have never felt. Okay. So that's how important, transition has been. It introduced me to happiness. It made me feel what that emotion of happiness is. Second and very important thing, thank you, in transition is, I consider my pre-transition and after transition, just like you have before Christ and, after death as BC and AD. We can divide our lives into those two phases. And also for me, the decision of transition was taken on the night I wanted to end my life. So it was one gloomy October night when I didn't find any support anywhere, in my friends, in my family, any person. And life was like completely hopeless. And let me tell you, at that point of time, I was professionally doing very well. I was teaching in coaching classes apart from the medical college, and I was earning pretty well. I don't earn that good now, as I was earning then. And I had all the money that I needed to spend my life comfortably. I had at least 4,000 Facebook friends. You know, I was staying with my mother at that point of time, who still is the most important person to me. But still, in that moment, I wanted to end my life. Because the problem, if I may say, was continuously with me. I couldn't change the room and the problem would change. I couldn't just be with another person and the problem will stop existing. And I had to do something about it. And the thing which was stopping me from taking the step of transition was that my mother is not agreeing to it, that my family members are not agreeing to it. Of course, dunya bhad mein jaye. No, we don't care about the world, but you care about your immediate family. And since they didn't agree, I was in a very sad state. And at that point of time, I said, Ki, Aksa, you have to either choose yourself and your life, or you have to do suicide. There are only two choices because you can't live like this. And I did a selfish decision. Instead of sacrificing my life at the altar of the respect of my family, I decided to choose myself. And I said, no, you are not dying. You are living. You're living for yourself. Even if your entire family decides to forsake you, even if the entire world says you are a bad person, what you have done is wrong, is sinful, still you're going ahead and doing it. And that was the night when I decided to transition. So I always divide my life into those two phases. And every day, which I have after that night of 27th October 2014 is a blessing for me. एंड देखो पीपल ऑलवेज से कि ये जो अक्सा है ये ट्विटर पे कुछ भी लिखते रहती है नरेंद्र मोदी के अगेंस्ट या अमित शाह के अगेंस्ट, लोग तो इतना डरते हैं. एंड इवन एट वर्क प्लेस फॉर एग्जाम्पल आई एम नोन टू बी वेरी बोल्ड एंड करेजियस, एंड नॉट बी pleasing anyone. And they say, why are you so fearless? And I say, you generally fear about your life You fear about your family members and close ones. And for me, this life is a bonus life. So it's okay. I mean, I just live one day at a time. So it's okay if I'm able to live this, but I have to be able to sleep at night with the satisfaction that I have done justice to my new life. I'm answerable only to myself, you know, and therefore I feel that क्यों किसी से डरे भैया, वैसे ही हमारी जिंदगी जो है ये बोनस है, इसको जैसे मन करे वैसे जियो, अपनी खुशी के लिए जियो, to spread positivity in the world, to do something good for other people who are also suffering like you were suffering in the past. And that this is what, you know, has given me a lot of courage in life to do the impossible stuff, to take on challenges, to say no to people, to just not be afraid of any damn consequences, to be honest. So that's how, yeah, I can describe my transition, and it is. And frankly, no one supported me, neither my family. फ्रेंड्स का देखो सपोर्ट होता है कि हाँ यार तू कर ले, हम हैं तेरे साथ, but ultimately you have to walk that path. You know, no one is going to sit or sleep on the OT table for you. No one else is getting their name changed. No one else will have to take that difficult walk across the market where you don't either look like a man, you don't either look like a woman. Even if they are accompanying, they feel embarrassed, but you are that person, you are going to be that person. So ultimately, it's you. So while we look for support and it's very helpful, but remember that it's you who need that courage. Ultimately, you know, to whatever may be the damn consequences, I'm going to do it because I have
Ex-
that conviction that what I'm doing is right. It's good for me and it's
Beautiful.
therefore good for others also.
That's really beautiful. And we are, I mean, I don't know about others to be honest, but like every time I talk to you, I just have this big wide smile and I'm like all the time I'm like that she's such a pure soul and I'm really, really glad that I know you. And we have like, if even if someone supports or not, like you said, it has to be you and only you. So that's another great point for our viewers. So thank you so much for that. And I think that by the end of this discussion, we'll have like innumerable, Dr. Aksa's quotes, I would say. So thank you for another one. And moving ahead, ma'am, so could you please throw some light on the LGBT health? Like, what are the basic issues that need to be addressed in healthcare sector with respect to LGBT health? And also to mention that how COVID-19 has affected LGBT health in particular.
It's going to be a little long answer, so bear with me. Uh, I will ask everyone, you know, to do this thought experiment and to imagine that they are with a friend, they are with a trans friend, a visibly trans friend. What I mean by visibly trans friend is someone who does not look like a cis person, someone who is going to get those second looks of doubt कि ये आदमी है या औरत है, इसको हम सर बोलें या मैम बोलें, या अगर किसी वॉशरूम में चले जाएं तो हमको डाउट हो कि ये गलत वॉशरूम में तो नहीं चले गए. So imagine yourself with that friend. Imagine going to Medanta Hospital, walking across the reception where thousands of people are there walking in and out of that hospital, and you are with this person, and you go there, you go to the reception, and you ask for a paper for gynae OPD. And this person does not look very feminine. Okay, they are, let's say, a trans masculine person. You ask for a gynae OPD paper for this person, and they are like, ये तो आदमी है, gynae OPD सिर्फ औरतों के लिए होती है. And then you are like, what should I answer? Because I cannot say ये औरत है because let's say they are a gender non-binary person. Or let's say they identify as a trans man. So naturally you don't want to offend them by saying कि नहीं औरत है. We want to say नहीं ये आदमी है लेकिन गायनी ओपीडी का पेपर चाहिए. चलो ठीक है, रिसेप्शन ने पेपर दे दिया, मेल फीमेल जो भी लिखना था लिख दिया. Now you go into the waiting area of the gynae OPD. with this person, and they're all females sitting there with their family members, and you have this friend of yours who looks like a man and they are the patient. Then you enter the doctor's clinic, and then again those curious looks and questions ki matlab kya kyun aaye ho yahan pe, right? And then let's say they want to get a per vaginal examination done, per speculum examination done. What I'm trying to say here is that for a trans person to access something very simple, as simple as a visit to a doctor for fever, for an abdominal pain, for any menstrual issues, for example, can be such a huge challenge that their 2 hours, of traveling through the public transport, passing through the hospital, judging judgments by the doctor and other healthcare professionals, and then coming back to the home, that entire period can be such a transphobic experience that they may as well prefer suffering the consequences of the disease. They may as well self medicate themselves rather than visiting a doctor. So, the price that this person is going to pay because of the transphobia of the other people can have life threatening consequences. A tumor, a cancer, for example, cervical cancer, which could have been detected earlier, would not have been detected. So, a very simple example of how transphobia can kill indirectly by making our healthcare inaccessible to the trans persons. And therefore, remember that second glance, वो जो हम घूरते हैं ना, वो घूरना भी किसी की जान ले सकता है. आपको लगता है हमने तो वायलेंस थ्रू वर्ड्स किया ही नहीं, हमने तो कुछ नहीं बोला, हमने उसको हिजड़ा नहीं बोला, हमने उसको छक्का नहीं बोला, हमने उसको कोई नाम नहीं दिए, हमने उसको सर मैडम कुछ नहीं बोला, हमने तो बस घूर के देखा, हमने तो ऐसे देखा कि पता नहीं है कौन है. आपका वो जो देखना था, दैट ग्लांस, दैट लुक इटसेल्फ has hurt that person so much that they decided next time not to visit a doctor, and that could kill them. So there's so much to do in the healthcare system, right from changing our forms, changing how the infrastructure is made, how the labeling is done, how the staff is trained, how the doctors are trained, and everything. But very importantly, even if everything is fine, what will you do of the samaj around us? What will you do of the society around us? If they are not sensitized, then ये vicious cycle तो चलता रहेगा. And therefore, it's very important that when we look at the healthcare systems, we don't look at them in silos. We don't look at them in isolation. If I want to access healthcare, I have to pass through this ocean of humanity, which is also transphobic, coincidentally. So while we must focus on the healthcare, we must not forget that we are all part of this microcosm, and therefore everyone needs sensitization. Right from that security guard in the hospital to the person at the chemist shop counter. Now, when it comes to how the lockdown has affected the trans persons, I know most of us, probably those who are not trans persons or those who are not well versed with the trans communities, especially the socio-ethnic groups like the Hijra or the Kinnar community, would probably not know how they live, how they earn, how they die, how their funeral is done, how their surgeries are done. Most of the people may not have an idea. So, most of the trans persons who are part of the socio-ethnic groups, like the Hijra community, the Kinnar Gharanas and all, they have some traditional professions like badhai, generally on the birth of a baby, on marriages, and so on. They also are the people you see on the traffic signals begging for alms, and you just roll down your windows, you give them a 10 rupee note, and you quickly, roll up your windows. They are the same people whom some people visit for sex work. Remember that when someone is doing sex work, someone is also using that service of the sex work, and most of them are cis het men who go to a trans person for sex, but then at the same time are also transphobic. Okay, and that is why we always say that sex should never be confused with love. They have sex with trans bodies, they don't love trans persons. And then there are a lot of trans persons who are involved in the NGO sector, with the peer counseling, with the HIV, may condom dena, peer counseling, I mean, all those kind of. And when the lockdown came, all these professions came to a standstill. Of course, there was curfew, so you couldn't go to a traffic signal and back. There were no cars on the roads in the first place. There were no marriages happening, or even if they were happening, they were very on a very small scale, right? And with all these problems which were there, naturally the suddenly it came to a standstill. Now, how many people, a beggar, and let me tell you this, a beggar who was begging even in the normal circumstances, if I may use the word normal, in these extreme circumstances, what more can they do? They were already a beggar. What do you expect them to do now? मतलब जो काम करने वाला इंसान है, when they get an adversity, they may resort to begging. But what do you expect a beggar to do in a difficult situation? And unfortunately, our government didn't even notice that a trans community exists. So most of the trans persons, they survived because of the mutual support of each other. But what the government offered was 1500 rupees. And that too reached less than 5% of the official count of the trans persons. And if there are any trans persons in the group, I'm sure they might not have even heard of this 1500 rupees or gotten an advantage or even tried to get it, because it's too less for anything. It won't even probably get you 2 shots of vaccine. Even that is more costly. And what happens to the transitioning trans persons? You are on hormone therapy. You suddenly, your endocrinologist stops doing consultation. You wanted to get a surgery, but your surgeon says my hospital is closed because of COVID. You wanted to get your name changed, the gazette office is closed, the lawyers are not there, the advocates are not there. What do? You live in dysphoria, you live in pain, and you live in the bad mental health space, which was anyways very bad. And then what do? We don't even know how many trans persons might have died by suicide in this lockdown. We don't even have a figure. You might not even find their bodies floating in Ganga. So it's that bad. And that is why we sometimes feel that we are so privileged that we survived through 2 COVID waves. And not just survived, we thrived. So it's now an onus on us to give back to the society. When I say society, to the trans community, and be the voice for those who can't afford to come out and speak because they don't have that much privilege. So I can keep on speaking on the problems and how bad the situation is, but then let me tell you, the most bad situation or the worst situation is of those who are not visible, and the trans persons are definitely one of those invisible sections of our society. Over to you, Bhavya.
Thank you so much, mom, for that really, really, I would say, grave situation which is there in the society these days. And like you just told about the 8:30 and all, I was also reading there, and I really saw your posts. So my next question is regarding that only. That so there was a post, I would say, not just a post, there was a coverage by media on you, that what were the real reasons that why um the trans community or the LGBT community are being, so afraid to get vaccinated. So could you just throw like some little light on it?
First of all, we need to understand that the trans persons are also part of the same society in which all of us are living. So whatever phobias, misconceptions, fears that the cis person have, the trans persons are also going to have them, right? So just like cis persons have questions कि is the vaccine really effective? अरे यार उसने वैक्सीन लगाई थी उसको तो उसके बाद भी कोविड हो गया. तो ये रियली whether it works, अब तो वेरिएंट आ गए हैं, whether it will work against the variant. Then the cis persons also have questions about fertility. They have questions ki whether it's going to cause me some heart disease, whether it's going to cause me some cancer. I don't know how safe it is, you know, whether I'm going to get some allergic reaction. So the same questions the trans persons also have. In addition, because of their special circumstances, the trans persons also have some other questions. And this include as to like whether it's going to somehow interact with my hormone replacement therapy. I want to get operated a little later. Is it going to cause increased chance of blood coagulation? Some people may be on prep, so is it going to interact with my prep medication? Is it going to be affecting my blood pressure levels? So all these questions are definitely there. And unfortunately, since the trans persons, they are one of the protected groups for the clinical trials, most of the clinical trials did not include trans persons. And even if they wanted to include, most of the trans persons would not be taking part in a clinical trial because they're afraid of the medical system. And therefore, we didn't really have data, to start with as to how the trans persons and the vaccines are going to interact. But fortunately, now it's been more than 4.5 months since the vaccine was launched, and nearly 6 months when the vaccine was launched internationally. And therefore, we have the data now that it is safe for the trans persons to take the COVID-19 vaccine even when they are on HRT. We may not have very solid long-term data, about trans persons in HRT. But what we know for sure is this, that if you don't take the vaccine, then your chance of getting COVID and therefore clotting and dying is much, much, much higher as compared to you getting a clotting or a thrombosis episode after taking the vaccine. I was in a panel discussion yesterday with Professor Shahid Jamil, who is one of the India's leading virologists. And he gave this very simple example. He said that the chance of getting a clotting episode after getting a COVID vaccine is somewhat similar to you getting struck by a lightning. And how many people do you know really who have gotten struck by a lightning, right? So it's really not that common, and therefore the trans person should go ahead and take the vaccine.
Great. And now, what do you think are the hurdles apart from awareness or apart from the reluctance because of the absence of clinical trials for them not taking the vaccine?
There has been a power cut, so I'll have to switch on my phone's hotspot to connect the laptop. So just give me a minute.
Oh, sure.
I think I'm still having the Wi-Fi, so we'll continue with it and let's see if there's an issue. Can you please repeat the question?
Sure. So, ma'am, like you've mentioned that there has been reluctance because of presence of no evidence regarding the COVID-19 vaccine in the HRD and these studies of trans people. So, other than that, the awareness or the absence of trials, what do you think are the other reasons for them not taking the vaccine?
I think there are numerous challenges, and the first and foremost is lack of a targeted communication with the trans community. You know, so just like for the election campaign, if you see, the government of India did election campaign also for the trans persons. They did election campaign for the persons with disability. They encourage a lot of young voters to come and vote. They encourage trans persons to come out and vote. Have you seen any ad which encourages trans persons to come out and get their vaccine? No. So, in the absence of that kind of a communication, to expect that there'll be a lot of enthusiasm in the trans community and they'll come on their own to take the vaccine, that's not going to happen. Secondly, unfortunately, we have a man-made disaster in the pandemic, and that's called COVID app. The COVID app is more difficult than the IRCTC app, which we used to abuse a lot earlier. And booking a slot for a vaccine is now more difficult than booking a train ticket. In fact, I mentioned yesterday in this slide that probably it's easier to get married in India than to get vaccinated. You know, it's actually that difficult. Uh, and within seconds, slots are getting booked. We just created a session for Monday for the vaccination in our center, and within 5 minutes, all the 100 slots were gone. Now, a trans person who does not have that digital privilege, who does not have that privilege of literacy, who does not have that privilege of internet connection, how do you expect them to be in this race and win the race of booking a COVID slot, especially for 18 to 45 age group in which most of the trans persons come. As you might be knowing, in Delhi, 18 to 45, because of lack of vaccine, all the government vaccination centers are closed. So where does an 18 to 45 trans person go to get the vaccine? Can they afford 1250 rupees for one shot of Covaxin, which is the price in my center, being a private center? And again, there are issues with the Aadhaar card. There are issues, with the change of the name and the gender in the Aadhaar card. What if you look feminine now, but your gender mentioned on the Aadhaar card is still male? What if I say that I want vaccination certificate in the name of Aksa, but my Aadhaar is in the name of Zakir Hussain, for example, which was my dead name. I say यार छोड़ो अभी आधार कार्ड चेंज कराते हैं उसके बाद जाएंगे वरना वो 10 सवाल पूछेंगे उसको क्या क्या जवाब देंगे so these are some of the reasons, and that's why we want that the COVID app should be just removed and the vaccination process should be made simple. See, no one is going to get 10 shots of vaccine, they'll stop after 2, maximum they'll take 3. चलो हो सकते हैं कुछ लोग होंगे ऐसे जो कहेंगे नहीं हमको 3 डोज भी लगा दें. But then no one is going to go beyond that, right? And previously we have been giving a lot of childhood vaccination. Abhi bhi chal raha hai. Pregnant females are getting vaccinated. People are getting vaccine against hepatitis B, for dog bites, everything. This is not the only vaccination program in India. So you don't really need कि उसको इतना complicated बनाए. So we need to follow the KISS principle, that is keep it simple, stupid.
Great. I really enjoyed that answer. So, ma'am, next question is that apart from transgender health, how do you think the health of the other communities, whether it's the mental health or it's the sexual health, how has it been affected due to COVID-19?
I think there's not a single person or a single family which has not been affected during this lockdown, So everyone is. In fact, when I started my work in the social work sector back in February 2020, a year back, we were not doing it for the trans persons. We were doing it for the victims of communal clashes and riots in Northeast Delhi. And during that time, we were helping them with medical rehabilitation, with getting back to their feet. When in March 2020, the lockdown was announced. And then when we saw the suffering of the migrants, those visuals, I don't think any one of us can forget, where the migrants were walking bare feet, carrying their entire, livelihood with them, the families, their entire lives with them, the burden of their lives. They were walking from Delhi to UP and Bihar, because everything was closed, all transport was closed. Their feet were wounded, they were bleeding, but they were still walking. So when we saw that suffering, we decided that we need to help them out with food kits so that they can stay back, for a month. We help them out with rents, we help them out with medications. But then that's what you can do to a little extent, right? um, and now again, in the year 2021, we were finally thinking that there'll be some hope, there'll be some positivity. The second wave came, and then we were again back to the same situation. So all apart from, of course, a certain section of the society, I think everyone has suffered, especially also on the mental health front. Young children, I was discussing with my colleague yesterday, and he was saying that his son, who has never been to school, because last year he was supposed to take admission in school and it didn't happen, and this year is their second year in schooling from home, and they don't know, how a normal school is supposed to be, where they're supposed to go and sit with other children and learn, and there is a teacher who is an actual human being in front of you. They don't know anything. They only know about Zoom, that some human faces appear on a computer. You talk to them, you listen to them, and that's how you learn. So things are that bad, and the vaccine definitely is something which has given us hope of getting normalcy. We're seeing other countries from the Europe, we're seeing other countries from Northern America getting back to their normal lives. So that gives us hope that, if we can really get a vaccination thing on track, we may have finally achhe din come into us.
Thank you, ma'am. The next question says, in the medical profession, what should we prioritize, individuality or professionalism?
Can you repeat the question, please? It's not on.
Yeah, in the medical profession, what should be the priority, individuality or professionalism?
I don't think professionalism excludes individuality. You know, I remember that on Twitter, sorry, I had tweeted about this attack on a doctor in Assam, Hojai district of Assam, and how some people were trying to give it communal angle. And then one doctor, I think they're doctor, they mentioned that, I am a doctor, and for me, my profession comes first, and then my faith does not matter, and anything does not matter. I'm only a doctor. And I said that, sorry, but I would like to disagree with you. You are not just a doctor. You are also a male doctor. You are also a female doctor. You are also a transgender doctor. You are also an Indian doctor or an American doctor. You are also a doctor who may be Dalit, or who may be a Brahmin, or who may be from some other caste. You are also a doctor who may be straight, or who may be gay or a lesbian person. You are also a doctor who may have faith, or who may be an atheist, or who may be an agnostic. You may be a young doctor, you may be an old doctor. So you don't really say that once I become a doctor, then I have to, kind of renunciate all these identities. You can't. Caste, for example, is something which you can't just leave behind. It's a reality which will be there throughout your life. Similarly, the sex assigned to you at birth is not going to leave, it's going to keep haunting you, right? So, but the thing is, in spite of all these factors, if you are still able to do what is in the best interest of your patient, then it is fine. But if you are a male doctor and then you are sexually harassing your female patients, then that is the problem. If you're a Brahmin doctor and you are abusing your Dalit patients, then that is a problem. So the problem is not with my individuality, the problem is not with my identities, the problem is not the faith that I'm practicing. The problem is whether that is affecting the service that I'm giving to my patient. And that should never happen. And frankly, we can never be just Indian. हम लोगों को कहते हैं ना, आप पहले इंडियन हो, कि आप पहले हिंदू हो, या आप पहले डॉक्टर हो. अरे भैया पहले इंसान तो बन जाओ. So that's the most important thing to understand, that you can be a good doctor, you can be a good professional in spite and despite and because of all of these things.
Awesome. Another doctor asks us quote that I would like you all of you to take home is that be a good human being first, baki sab baad mein ho jayega. So the another question for you is, ma'am, that we found that you're also working, like you've also heading a foundation which you started, that's Coho Foundation for Mental Health. What would you like to tell our viewers a little bit about what is it, and what do you guys work in that?
So, CoHope is actually an initiative under the Human Solidarity Foundation, of which I'm the founder and director. And we started CoHope somewhere in the later half of the second wave of COVID in Delhi, where we found that a lot of doctors who were battling with the COVID, with a lot of volunteers and support workers who were battling COVID, the oxygen crisis which was there in the city, they were seeing the dead not even receiving proper last rites. And that really started affecting me. It started affecting my friends. It started affecting everyone around us, and that was when I got together with a few of my psychologist and psychiatrist friends, and I told them, let's start a free teleconsultation helpline. We were doing that already for our medical support. We were running a medical teleconsultation helpline for the COVID patients with more than 50 doctors, and we have served now 2,500 patients. So with that background, with that experience, we started Coho, which was to provide mental health support through teleconsultation, completely free and confidential service. And that's how, we started Coho. And there's a huge amount of work to be done. We have started, but we feel this is just the first step, because there's still so much stigma attached to mental illness that doctors would rather do suicide than go and speak to someone, क्योंकि हमने उसको इतना ज्यादा वो कर दिया है कि उसके लिए वो आसान है, ये आसान नहीं है कि किसी से बात कर ले. So this is an attempt that we are doing in the mental health space.
Great. Last question for you, ma'am. That is, what message would you like to convey to our participants today as a representative from this community, and as well as a healthcare worker?
I would just say be yourself, be yourself, and you will see that your inner light will shine, and it will also shine light on the path for the others. I am genuinely very surprised, Bhavya, when people message me and tell me that I am an inspiration for them. And why I'm surprised, I'll tell you. At the many a times, I think, Aksa, your life sucks. What have you done today? क्या किया तुमने? And then people come and tell me that you are an inspiration. So sometimes, just surviving by a trans person can be inspiration for a lot of other people. So I'll just tell the trans folks who are listening to me, survive. Please don't die. Survive. Don't kill yourself, right? I know it's very difficult. I cannot say that I can understand it, because every trans person's story is different. Your struggle and my struggles are different. But I can imagine how bad it can be, because I have been somewhere there. But trust me, now when I'm here and I can speak retrospectively, and we are always wiser in the hindsight. So I regretted my decision of trying to end my life, and life is beautiful. So please live on. Tomorrow will definitely be better. We are trying to make it better, and we'll work together to make it better.
That's another, I would say, take home message. And ma'am, it's been like, really an honor every time we talk to you. You instill so much of, I would say, like, it feels like we're in the spring season where there's so much happiness, fragrance, flowers all around. And that is the very basis of having such a pure soul in the room. So we are really, really glad, and we really thank you for taking out time for us today and talking to the viewers about, not just your struggles, but struggles of, I would say, humanity as a whole. So thank you so much. And I guess we can wait for another 2 minutes if the viewers have any more questions. And we'll wrap up in another 3 minutes. I can
I
see 2 or
always
3
end my
questions.
interviews by asking a question to the interviewer. So are you prepared to
Okay.
take my question now?
Sure. I mean, whatever you say, ma'am.
Did you take your vaccine?
Yes, I did.
Great, great, great. Were you afraid when you entered to take the vaccine?
Initially, I did not take it, like when I was back in Delhi, because yes, I was very afraid. Like, the roommate I had, so and my best friend. So, like, my best friend, he was telling me that, मेरे पापा के फ्रेंड का बेटा मर गया तो तू भी मर जाएगी and ये हो जाएगा वो हो जाएगा and I was like so afraid and like he's like the person who's so close to me back there, so like we both did not go to take vaccines. Like that wasn't the only reason I did not take, because like we were having our first professional examinations and uske andar, like everything was so hurdled up. But once I came back in Amritsar, like which is my real hometown, after like the another lockdown. So yes, I did take both the vaccines, and I was like, I'm this person who really thinks that, like you said, to live in the present. So I was like, अब जो होना है वो हो ही जाना है. चाहे vaccine लगाओ चाहे ना लगाओ. Like I do believe in destiny in these issues where death in life is there, because I believe that अगर मरना है and if it is already designed in a certain way, तो तुम vaccine लगाओ चाहे ना लगाओ, it is bound to happen. And अभी के लिए तो vaccine is the only one which can save us. So yeah, I did take and I wasn't afraid after I came back.
That's really a very interesting story. And I guess a lot of people who have delayed vaccination and have taken it later would have, a story of conquering their fear, to
Wow.
get their shots.
Thank you, ma'am. So I guess we have one question here, which is by Parth Punder. So he says, any thoughts on the relevance of biological markers in determining the relevance of entry in fields of sports or quota for admission jobs? For example, if a man officially changes his or her gender and enters a women competition, probably is that person will defeat all her competitions simply because of biological build of the person? Shouldn't we then consider biological markers in that case?
Well, this is a question of debate, and the scientists are trying to look at a solution which is acceptable to everyone. So they are looking at testosterone levels, then all of things. I read a story just 2 days back in the newspaper about a study which mentioned that in marathons and long, marathons are still 42 kilometers, but then races which are even much longer, where you got longer endurance, women are not just equal to men, but they even outdo men, when it comes to the very long duration races. But I'll tell you something more importantly, why I don't really bother much about sports and trans persons, though it may be, a very important thing for someone else. But I personally don't bother much about it, is because it's not a question of life and death. When you are in a pandemic, for example, most of the people can relate to it. You will not make a fuss कि India जीतेगा कि Pakistan जीतेगा. विल नॉट मेक अ फर्स्ट कि इंडिया वर्सेस ऑस्ट्रेलिया में कौन अच्छा खेलेगा, आईपीएल में कौन जीतने वाला. अरे भैया, यहाँ लाइफ एंड डेथ का क्वेश्चन है. So my focus as a trans person and as a trans medico, frankly, to be honest, is more on the healthcare acceptance, and I don't give much importance to sports and those nitty gritties of hormones and all the things. अरे भैया, पहले जो ट्रांस पर्सन आपके सामने उसकी इज्जत कर लो. दैट्स मोर इम्पॉर्टेंट. यू नो जो मरीज आ रहा है एज अ ट्रांस मरीज आपके पास आ रहा है और आप एक डॉक्टर, तो पहले उसको ढंग से देख लो. बिकॉज दीज इश्यूज, कि कौन सा जीन है, कौन सा क्रोमोजोम है, कितना हार्मोन है, एंड ऑल दोस काइंड ऑफ थिंग्स, दिस आर नॉन एंडिंग डिबेट्स. No two women are similar, no two men are similar. Not all men have the same endurance or strength, right? You can always say then that it is not fair for the Kenyan athlete to compete with a Japanese athlete or a Chinese athlete, because then they're different. So there is no end to this debate, and I wouldn't really want much to engage with it. But most important is to look that how trans persons survive.
Great. Thank you for another great answer. So before we end this event today, I'd like to, tell you one quote that I really use in my life and that, has made me, I would say resistant to any comments or anything that comes to my way or anyone else's way. So there is one quote that says that I'm not the opinion of someone who doesn't know me. That's a very good quote by Taylor Swift, but what is my version of it is that I'm not the opinion of rather anyone. Because, even if someone knows you, he or she would not make an opinion about you. And to have an opinion from someone, which simply means that you lack self-trust and you are lack of self-confidence, which I think is not just in maximum cases in the LGBT community, but rather in every person who hasn't been, through thick and thin. So another last thing that I would like to end up this meeting is that if God is, he's putting so many things on you, just know that you are his favorite and he's really checking if you are worth of all the accomplishments that you are going to have in life, because कोई भी चीज आसानी से नहीं मिलती है. So if he has chosen you to be the best person in the world in your career, then he will definitely check you through that time, and by that he is checking your endurance. So thank you, Dr. Aksa, again for being with us tonight, today, and thank you for your precious time. And we really appreciate and we really send good wishes and love to you and your loved ones, and happy Pride Month.
Happy Pride Month to everyone. Thanks for joining us today.
Ma'am, we cannot hear you.
Okay, I guess I had lost the audio for some time. So I was saying that I had a
Yeah,
great time. Am I audible now?
perfectly clear.
Okay, so I was just saying that I had a great time having this discussion. It was fun, it was emotional, it was engaging, and I just wish everyone a lot of good health and safety from this pandemic. So stay healthy, stay safe, and don't forget to take your shot.
Thank you, ma'am. Thank you, everyone, for being a part of this today. And I believe that, all of you must have learned a lot of good things today, directly coming from the legend, Dr. Aksa. Thank you, everyone. Yes, before we end, can we have a little group picture if everyone can just turn on their cameras? I forgot. Can everyone just turn on their cameras? Suleikha, Mariam. Okay, Ananya, can you take a group picture? I mean, I'm on my laptop. I won't be able to take it over my laptop. So could you see like a grid? Has everyone switched on their cameras?
Um, I can see only you. I mean, yeah, you, me, Survi, and ma'am.
Okay, no problem. We all will smile. Great. Thank you again. And I'd like to pay special thanks to my team. That is Suleikha Intiru. She's the Assistant Director for Shrisog. And my four wonderful NOs, it's National Officers, Ananya, who's here, Surabhi Khanna, who's here too, Mariam, and Priya. So without them, the event wouldn't have been possible. And again, a huge thanks and warm love and welcome to them. Thank you, everyone.
Thank you. Thank you. Okay, to leave the meeting now, Bhavya?
Sure, I was just seeing where to end the webinar from.